Many major economies in Southeast Asia surged more than 5% in the fourth quarter of last year. The robust GDP growth was driven by strong global demand for artificial intelligence. Singapore's GDP jumped 6.9% from a year earlier thanks to strong chip exports. In Malaysia, chip shipments and a wave of data center projects lifted growth to 6.3%. Elsewhere, Vietnam's economy climbed 8.4% and Indonesia's 5.3%. Growth in Thailand was comparatively modest at 2.5%. The country's key industry, tourism, has been hit by a weaker dollar against the Thai baht after U.S. interest rate cuts. Analysts say the outlook for the region remains positive, supported by buoyant AI demand. But some are warning about the potential impact of tariffs imposed by the Trump administration. Now to India, where AI is reshaping frontline healthcare. The northern state of Uttar Pradesh has opened an AI-powered clinic, marking a major step forward in the country's use of artificial intelligence in medicine, particularly in rural areas where doctors are few and far between. The clinic was launched last month at a government institution. India faces a shortage of medical facilities, especially in the countryside. Securing specialists to diagnose and treat conditions such as cancer and heart disease remains a challenge. The clinic uses an Indian-developed AI diagnostic system. It analyzes patient X-ray images, blood test results, and genetic data submitted by doctors. Using the AI's findings, physicians aim to detect serious conditions at an early stage. They also hope to support doctors in remote areas by sharing treatment plans and providing expert guidance.
This AI clinic was not just an awareness campaign. This is to create access to the last village, access to the top-class clinicians. We have this capacity where we see almost 2,000 patients every day.
AI is expected to play an increasingly important role in medical imaging and drug development. But some healthcare professionals are cautious about its rollout due to potential privacy violations and information leakage risks. A growing number of Indian nationals have been seeking jobs in Russia, which is experiencing labor shortages heightened by its ongoing invasion of Ukraine. But some have allegedly been tricked into fighting in the conflict alongside Russian forces.
5 years ago, this garment factory near Moscow first hired just over 20 Indian workers. Now, nearly all of its sewing staff are from India. The monthly salary here is close to $800, 5 to 6 times what many workers say they could earn back home.
In India, my salary is low. I can earn much more in Russia. My children back home live on the money I send them.
For years, manufacturing and construction sites across Russia relied heavily on laborers from Central Asian republics. But that changed dramatically after a deadly terrorist attack in 2024. After several suspects from Tajikistan were indicted, public sentiment turned harshly against migrants from Central Asia. Russia's Interior Ministry says more than 23,000 Indian nationals received work permits between January and June last year, 1.8 times higher from the same period the year before. Meanwhile, some Indian job seekers have allegedly been sent to fight in Ukraine. Sarabjit Singh says he was one of them. In 2024, he traveled to St. Petersburg after an acquaintance told him about a well-paying courier job in Russia. But upon arriving at the airport, he says he was suddenly detained by authorities.
The police who cleared our immigration were also there and took us to a building in St. Petersburg.
Singh also says he was forced to sign a Russian contract without knowing the job details. He found out he had signed up to join the army when he was taken to a southern region bordering Ukraine.
Agents told us that we didn't have any other option. If we tried to escape from there, we would be shot.
After only 15 days of training, he says he was sent to the front line in eastern Ukraine, where he spent 8 months in combat. Despite getting shot in the leg, he was able to return home after the Indian government repeatedly requested that Indian citizens lured into the Russian military be repatriated. But he says a fellow Indian who was duped into the army died on the battlefield.
As soon as he stepped out of our building, a drone strike blew him up in front of my eyes. Please, let me meet President Putin and talk with him directly, because many people are still left behind there.
For Sin, what began as a promising journey toward a better life left him with deep physical and psychological scars from a war he never intended to fight. And he's determined to warn others not to fall into the same trap.
And that wraps up our bulletin. I'm Rosalind de Bovalia in Bangkok.